All right, everyone, welcome to the MedMatrix weekly podcast we're doing. So I'm Cole, work with MedMatrix. I manage, a lot of our marketing and patient education. I'm here today joined by Colin. He's a physician's assistant, with a ton of experience as an integrative provider here at MedMatrix. Colin, thanks for joining. It would be great if you could just, introduce yourself, talk a little bit about your experience for those who might not know you.
Awesome. Great. Yeah. Thanks for the intro, Cole. My name is Colin. I'm a physician assistant with MedMatrix, as Cole said. I have worked in functional medicine, specifically more so for the past 4 years of my career, but I have been a licensed board certified physician assistant for about 6.5 years or so. I spent the first couple, 2.5 years of my career in what most would consider a more conventional medical model. So hospitals and I worked in a surgical setting, but I quickly realized that it really wasn't suited for what I believed I was best at. And the system is not really designed in a way to make people very healthy, which is what I wanted to do, was make people very healthy. And so I ended up, finding my way more into the functional, non-conventional type of approach, more proactive, preventive, health forward type of medicine that I've been practicing in now, like I said, for the past few years.
Awesome, man. Thanks for sharing. So today's episode, we're just going to be talking a lot about weight loss. I know we have a lot of patients who come to us looking for help with weight, whether they're kind of just starting out or maybe they've been struggling with weight for a long time. We have a ton of questions, a lot of which come from patients. So let's just jump right into it. So let's see. First, quick reminder, everything we're talking about today, it's just educational purposes only. This isn't like medical advice. So first question, why do smart, disciplined people still struggle to lose weight? So they're doing all the right things, they're working out, they're in a calorie deficit, they think they're doing everything right. Like how do those people still have a problem with weight?
Yeah, it's hard nowadays, I would say. Even if you think you are really dialed in and you're smart and you have discipline, we live in an environment, this modern world, that makes it really difficult to stay on track with our diet, first and foremost, with our sleep, with stress. We're overworked, underslept, undernourished, and we also live in an environment full of chemicals and plastics and pesticides and these things that disrupt our hormones. So these insults that are just constantly coming at us, that makes it a lot harder to be optimized. I know a lot of people don't like to use that word, but to be at your best. And not only that, but I would say, Cole, that little choices add up over time. And this is not to be neurotic or orthorexic, but the way you can think about it is, if you gain 5 pounds a year, that's 50 pounds in 10 years. 5 pounds a year is not a lot. It's not a lot of weight, really, if you think about it. And if you broke that down from a calorie standpoint, how many extra calories a day is that? It's not very much. So these little tiny things over time just really pile up over time.
Gotcha. Okay. So man, it's a lot of so are you saying like maybe 10, 20 years ago that it was maybe a little bit easier to keep weight off or were we talking like 50 years ago?
Yeah, I was going to say definitely not 10 or 20 years ago. In fact, I would say in some ways we've probably improved from 10 to 20 years ago. I would say more like 50 to 70 years ago, maybe like World War II, around that time frame, right? That it was a way different environment.
Gotcha. All right, that makes a lot of sense. So what are the most common hidden drivers you see when patients come in looking for help with weight loss? Is it sleep, stress, blood sugar, hormones, like prescription meds, maybe a conventional doctor has them on, that's leading to weight? What do you feel like are the biggest drivers affecting people's ability to lose weight?
Yeah, that's a great question. I would say, in no particular order, eating out is a big one. So DoorDash or going out to restaurants, you just don't know what they're putting in their food. You got to think the cooks, the chefs, they're not thinking about this from a health standpoint. They're thinking about how can we make this taste really good. So they're just throwing a ton of extra fats and extra sugars in every meal, and they are way more calorically dense than people think. So even if you think, okay, I'm tracking my calories, I'm just going to go have this one free meal. If you look at the Cheesecake Factory and their menus, sometimes they share the macronutrients. There's meals on there that are like 2,000 calories. So that's a really big one. Mindless eating, I would say, is another one where it's the end of the day. Somebody gets home, they go on the couch, they throw on Netflix, and they're sitting there just picking at food. And before they know it, they've finished half a bag of potato chips. The other big factor would be stress. We all face it. Cortisol is a pretty evil hormone. Necessary hormone, but in excess evil, I should clarify. And then poor sleep is a big one. That kind of goes hand in hand with stress. And then hormonal dysfunction, which can be a result of some of those environmental things that I touched on a little bit earlier.
Okay, so what is insulin resistance and how does that affect weight loss?
Yeah, so insulin resistance is a process in the body in which the body has secreted more and more and more insulin over time to a point where now the cells have become resistant to the signal. The signal being that when we secrete insulin from the pancreas, the idea is that we are taking the glucose out of the bloodstream and putting it into the cell. And then that cell uses that, puts it through the electron transport chain, and that's how we create energy in all of our cells. And so with insulin resistance, that signal doesn't get through. And this creates an issue. I don't want to go too deep on it, but basically your cells think that there's an energy shortage because the fuel that's coming into the cell is not it's not turning into energy because insulin's not putting it in the cell. So it ends up just staying in the bloodstream. That's why in insulin resistance, we see hyperglycemia, which means high blood glucose. Insulin is not taking it out of the blood and putting it into the cell. So what does this do? This blocks lipolysis, that blocks the burning of fats. Yeah, so that's one way. Now, it doesn't completely block fat loss. You can be insulin resistant and you can still lose body fat under the right circumstances, but physiologically it makes it a bit more difficult. So yeah, I would say that's kind of insulin resistance and how it affects our ability to lose weight.
Do you have any examples of like patients you saw recently who came in for weight loss and insulin resistance was an issue, and then you helped them fix that, and then the weight started to come off? And then if so, how did you help them correct their insulin?
Sure. I've got a case just recently within the past couple months. I just had it was a 2-month follow-up with this female patient. She initially came in and her blood work was a wreck. So this patient had, I'm talking triglycerides over 400. Her A1C was over 10. Cholesterol was through the roof, glucose through the roof. So metabolic dysfunction was purely evident in the blood work. She was struggling to lose body fat. And so what I did for her, I don't do this in every case, so this is not medical advice. What I did in this specific case, in this specific circumstance, was I told her to do a carnivore diet, which is essentially, it can be used as an elimination diet. It can also be used as a low carbohydrate diet. And she came back 2 months later and all of those numbers dropped significantly. And she also is losing weight again. I think she lost like close to 15 pounds in 2 months. So that's just one case, but a lot of different examples like that.
That's awesome. That's cool. So carnivore diet, like, there's somehow still a ton of hype around carnivore diet for like still like a year, it feels like. When do you actually recommend carnivore diet to a patient?
Yeah. When I would actually recommend a carnivore diet, it's more specific to certain circumstances. One of the main reasons I use carnivore diet, I should say, is actually as an elimination diet. People that have a lot of gut issues or inflammation that I believe is linked or tied to the gut, I will use carnivore as a type of elimination diet, because you're really eliminating all the foods that contain lectins, which can be gut irritants. So a lot of times I'm using it in that case. And then in cases, I would say of, because I myself, again, many providers have a lot of different techniques, and this is not 100% across the board. I don't love low carb dieting. I don't always do it. I would prefer that people do have some carbohydrates in their diet. But in cases like this one, where this woman's blood work, I mean, it was a wreck. I just wanted to take carbohydrates out of the equation. And so a carnivore diet is probably the easiest, simplest way to do that. You know, you don't call it ketosis, because so then people aren't worried about, oh, ketone strips and am I in ketosis? It's no, just very simple. Just eat meat, and that's it. It's very easy to follow.
Nice. Do you think people get more benefit out of it just from like the elimination aspect, opposed to like what you might think being like the high protein and the iron and it's more about what you're taking away than what you're putting in?
I would say that's huge, Cole. With a carnivore diet, you will see things. You'll see cases of people with lifelong eczema gone, psoriasis gone, joint aches for years gone. It's you can search anecdotes online. Of course, there's forums and Facebook communities. The transformations are sort of unbelievable. And I have, of course, patient stories of carnivore diet doing things like that. So it's an incredible tool.
That's cool. Awesome. Yeah, that's amazing. I have so much more clarity around the carnivore diet now after hearing so much about it. So thank you.
Yeah.
So man, like I hear this from patients all the time, just like struggling to sleep, especially a lot of women, especially dealing with like menopause, perimenopause. Like how does the lack of sleep play a role in, how does proper sleep play like an important role in weight loss?
Yeah. So sleep plays a huge role in weight loss. Primarily, I would say the main thing is that when you don't sleep well, you are sleep deprived, you're going to get increases in cortisol. Cortisol being that nasty player that can make it harder to lose body fat, especially around the midsection. So sort of hangs on to fat in the midsection. And it's going to create this glucose instability when you have high cortisol. Not only that, but probably the next biggest factor would be the fact that when you are not getting enough sleep, you will see rises in ghrelin and a decrease in leptin. Ghrelin is the hunger hormone. It goes up when we're starving. It's a signal, a hormonal signal from the body to eat and to find nutrients because it thinks we're dying. And so that does increase after a bad night's sleep. Pretty short term, even we can look at the research, pull it up, but even a couple nights of, I'm talking 1 or 2 hours less of your normal amount of sleep. And then there is also a decrease in leptin. And so leptin is this hormone that goes up when we are satiated, when we're full, when we've eaten enough. And so if it's too low, then our body thinks that, again, we need to eat more food.
Okay. Yeah, it makes sense. If you're not sleeping well, like, is it going to be really hard for you to lose weight?
If you're not sleeping well, this might be the one, I was going to say slept on factor, the factor that people sleep on. You know, it's like it's a factor that people underestimate. And there's even research to show this. Like if we looked back, I believe it's like 50 years, we're getting about an hour less of sleep from a population standpoint than we were previously. Part of that probably due to the fact that nobody can turn off the screens at night and there's just so much stimulation. So people are much more underslept than they think they are, and they don't really notice it. So this is a really one of those hidden causes, I would say, Cole, that does cause a lot more issues than people think. A lot of people really do Focus a lot on the diet and exercise, which there's nothing wrong with that, but you really can't leave out the sleep component.
Okay. Yeah, it's good to know. Switching the topics here a little bit. So do you believe it becomes harder to lose weight as you get older or keep weight off?
Yes and no. I would say yes, it does become harder to lose weight as you get older, mainly from a hormonal standpoint. Now
Okay, so
it's
how do sex hormones play such a key role in um, people's ability to lose weight?
okay. Sex hormones play a huge role in people's ability to lose weight. Testosterone, for example, is a big one in which directly and indirectly. Directly meaning testosterone improves insulin sensitivity and nutrient partitioning. That means when you eat a meal, where do the nutrients go? Do they go into the muscles or the cells, or do they get stored as body fat? So that's one thing that testosterone helps with: insulin sensitivity and nutrient partitioning. So that's sort of a direct effect. Indirectly, what I mean by that is when testosterone levels drop, people have less motivation, they have less energy. So then what do? They move less, they go to the gym less. They are less motivated to do things that they used to really like doing, like go kayaking or go hiking or do these more these physical activities.
Mm, okay, yeah, that's really interesting. So we had to talk about testosterone a while ago because, for those who don't know, Colin's actually my provider here. Um, and this is really interesting. So what's the relationship between testosterone, prolactin, and motivation and like yeah, I guess how do you know that, or like what do you want to see, or maybe not want to see, but what do you see on a patient labs that tells you like yes, this person's testosterone is playing a role in a lack of motivation?
Well, you could, in if you were suspecting that someone had low motivation levels because of high prolactin or low testosterone, obviously those things are things that you can test. So, prolactin, one of the main factors that affects prolactin levels is dopamine.
For those who don't know, how does prolactin play a role in motivation to begin with?
Prolactin is this signal for sort of rest and relaxation. The common example that everyone will use is post ejaculation. So after men ejaculate, prolactin rises, and that's why there's kind of this sleepiness afterwards that can happen. Um, whether you want to argue that that's like an evolutionary thing or some sort of biological, it's there for a reason, but it is built in. So essentially, that feeling, you can have that all the time if your prolactin is high all the time, or you have low motivation, because dopamine and prolactin are inversely related. So if you have very high dopamine, you will have low prolactin and vice versa. Now, testosterone, how does it relate to dopamine and prolactin? Testosterone does increase dopamine. There's some dopamine sort of signaling that can happen as a result of testosterone increasing. So if you increase testosterone and you increase dopamine, now you're more motivated because your prolactin levels are lower.
Gotcha. Yeah, that makes sense. Wow.
Mm.
Um, how come like this isn't talked about in conventional medicine as much? Like that seems pretty important to just quality of life, feeling motivated. Um,
Yeah.
yeah, what's your take on that?
Are you saying like why is testosterone and dopamine not talked about, or just testosterone optimization in general, or
Just like the this in general, as far as like motivation and testosterone and like this seems like obviously doctors want to help people, right? So like why isn't every primary care in the world talking about this to their patients, helping them out with their motivation and their hormonal levels? Why do you think that is?
yeah, for those listening that couldn't see, I just kind of giggled, and the reason I did was because we could probably do a whole podcast just on this topic hole.
Okay, try to do it in 30 seconds or less.
Okay, all right. So The reason why things like this are not talked about in conventional medicine, and when I say things like this, I mean health optimization or proactive approach to health rather than a reactive approach, is one, because the system is just not set up that way. It's this sort of relationship in which the pharmaceutical companies and the insurance companies and the billing and ICD-10 codes, and how it's hard a lot of times for practitioners to do everything they want to do without jumping through bureaucratic hoops. And not only that, but there's a lack of training in conventional medicine towards people having their best health. It's more so the mindset with conventional medicine primary care is, okay, let's make sure people aren't suffering and dying from heart disease, kidney disease, cancer, right? The big hitters, they're more so worried about that. They don't really care if, okay, well, you have a little bit less energy than you used to. You're not my worry. I'm worried about the guy with cancer, or I'm worried about the guy with heart disease. So that's kind of where it comes from, is they've got bigger fish to fry than you not feeling the way you used to feel.
Okay. Yeah. That makes sense. All right. So let's get back to weight loss, because that was the whole goal of this podcast episode. We kind of got off topic a little bit. So I got a lot of questions here.
No problem.
Okay. GLP-1s, super hot topic. Everyone at this point knows GLP-1s, Ozempic, semaglutide, Tirzepatide, Wegovy, all those. Like, when is it actually a really good idea, and when is it just like not?
When is it a good idea to use GLP-1s, and when is it not a good idea to use GLP-1 agonists? So my view is that these are a tool. They're an incredible revolutionary tool, I would even say, but they are not a replacement for good, sustainable, long-term habits. And I do not think they should be used long-term continuously. When I say long-term, I mean like greater than a year. So when they should be used, absolutely should be used, is in people who overeat. And this is a big problem. A lot of it comes from, childhood, people being told they have to finish their plate, or just not knowing what a proper portion size should look like. So there is a rampant overeating problem if we're talking strictly from a calorie standpoint and the population data that we have on that. So if it's pretty evident, you've done some food journaling and you see that somebody's eating way too many calories, that is the perfect opportunity to use a GLP-1, because how do GLP-1 agonists work? Multiple mechanisms, but in layman's terms, primarily they get you to eat less. They make you eat less food. They make you crave less junk food and horrible, high caloric, highly palatable foods. And when you eat less highly palatable, calorically dense foods, in general, you lose body fat. So those are the people that it's going to benefit from. Now, interestingly, Cole, I've seen a lot of patients where we give them GLP-1 agonists, and you would think that, right, like the benefit is while they use the medication, and it is. But I've seen many cases where people come off the medication and they tell me things like, it was one of the best things I ever could have done for myself, because now I know what is a normal amount of food to be eating. Like, I used to always go for seconds, and I used to always eat the dessert after the meal. And I realized that is not a normal eating habit. And so a lot of people it reframes their whole thought process and relationship with food, I would say. People who are obese, people who are diabetic, people who have heart disease are going to benefit tremendously from GLP-1 agonists and lower their risk factor for all chronic disease and all-cause mortality. What still matters the most with these drugs is that they should be in a caloric deficit. That is primarily how I do believe they are working, is putting people in a caloric deficit. it's going to be really, really difficult, but technically someone could eat their way out of the benefits on a GLP-1. I think it'd be difficult. In cases when I would not use a GLP-1 is someone who's maybe I can sort of sense this, and maybe it's a patient who has a bad body image or they have past eating disorders and they are sort of already close to their body weight goal and they just want to use it to eat less and justify sort of an eating disorder. I never use it like that. I always use it in people who are obese.
Yeah, it makes a lot of sense. I know I gotta get this thing figured out. Yeah, because I mean, you go online and some people like they think GLP-1s are like holy water and like everyone should take it forever. And then you go online and you hear some people say like GLP-1s are like come from the devil and they're the worst thing ever. And a lot of those people probably just have like understandably too, like maybe a predisposition against conventional medicine, or
Right.
they hate pharmaceuticals, so they just kind of label it everything as that because they have the brand name peptides, right?
Yep.
But there's a bunch of different GLP-1s. There's semaglutide, there's Tirzepatide, there's retatrutide. I think there's one more now. What GLP-1 do you recommend, when, and why?
My favorite GLP-1 agonist to use is Tirzepatide, and it's actually a GLP agonist and a GIP agonist. So it's
What does
kind
that
of
mean for those who don't know?
Well, the GLPs, glucagon-like peptide, and GIP, the name is running by me, but another gastric peptide. It sort of, these are peptides within our intestinal tract that affect things like insulin signaling, motility, meaning like the rate at which food moves through our intestines. And these play a big role in how quickly we absorb the nutrients from food, for example, sugar, and how quickly sugar spikes, as well as how quickly food moves through our intestines. So, for example, fiber slows the rate at which food moves through our intestines. That's one of the reasons why fiber is so filling and why it helps with blood glucose, kind of doing the same thing that a GLP-1 would do. Semaglutide, the first of its kind, not the first of its class, because there were other GLP-1 agonists before it, but it was the first of its kind that was FDA approved for medical weight loss. Mm-hmm. And that was in 2021, I believe. And it works very well. But my primary problem with it is I would say probably 40% of the time, you're going to get somebody who just doesn't tolerate it. There can be GI side effects. Mm. Whereas Tirzepatide, the newer kid on the block, the one that came about a year after semaglutide, is much better tolerated. Way less side effects in the way of GI problems.
Let's talk more about like patient case studies. So what's one of your favorite like weight loss patients case studies that you've seen, other than the carnivore diet person? That was a great one.
Favorite weight loss case studies? Mm-hmm. Is this just in terms of like overall results, or just most memorable, or
yeah, maybe most memorable, maybe most applicable to like what a lot of people are dealing with. Yeah, whatever comes to mind.
Okay. I mean, I've had multiple people who have lost, and I don't like recommend this or say that this is what everybody should do or it's right for every case, but I've had multiple cases where people have lost 30 pounds in 2 months, which I think is just like unheard of. It's difficult to achieve via anything but a GLP agonist. Mm-hmm. So those are some of my favorite cases. I think any of the cases, and you see this quite often, where someone is on multiple medications, blood pressure medications, or they might even be on like metformin. They're on cholesterol medications, and then We come back 3 or 6 months later after they're on semaglutide or Tirzepatide and they're off all their medications. Their A1C is normal for the first time in 5 years. You know, and that just happens so frequently that it's not really like, oh, I can single out this one case, because it just happens all the time.
Okay, that's great. Excited to hear. What about I guess one thing I didn't cover here in my notes is thyroid. I know a lot of thyroid can play a big role in obviously a lot of things in your health, but specifically weight. So could you explain just like how thyroid plays such an important role in weight loss?
The thyroid is an integral part of weight loss and weight management. And the reason why is for a couple reasons. One, the thyroid gland releases two very important, well, it releases multiple hormones, but primarily T4 and T3. And these hormones are the thyroid gland hormones that are responsible for setting our metabolic rate, basal metabolic rate. So the basal metabolic rate is how many calories does your body use at rest when you're doing absolutely nothing. And so you could think like, if I was just to lay on a couch all day long and do nothing and didn't move all day long, that's my basal metabolic rate. So that might be, 1,500 calories. But if I ate that day 1,500 calories of food, then I didn't gain any weight. But if my thyroid wasn't working properly and I had poor thyroid function that then downregulated and lowered my basal metabolic rate, let's say to 1,300 or 1,200 calories. Well, now that same food that I ate is going to make me gain weight because now I'm in a caloric surplus. So that's a big, big part of it. And then the other part of it, I want to come back to something that we kind of touched on, or I don't remember if we touched on it earlier. Maybe I'm making this up, but the thyroid, T3 specifically, which is the active thyroid hormone, is incredibly important for ATP production at the cellular level. So our body's ability to create our, like a car uses gasoline, our cells use ATP. And you can't get a lot of ATP without adequate T3, thyroid hormone. And if your cells aren't getting energy, there are these neurons in the brain. They're called neuropeptide Y neurons and POMC neurons. And these they sense energy from our cells. They sense how much energy is being produced. So ATP, how much is being produced from the cells, tells these neurons, okay, we're good. We've got a lot of energy. Everything's okay. You don't need to feed us more. But if your cells sense that there's or your brain, senses that there's an energy shortage because ATP is not being produced, what does your brain think? It thinks you're starving, right? Because it's saying, we're not getting fuel, feed us, give us more food. And this is actually one of the problems, Cole, with obesity is some of these neurons that get manipulated. Is you're obese, you have an excess of energy, but your brain literally thinks you have an energy shortage and it tells you to eat more. And that's because if we go back to insulin resistance, right? The insulin is not taking the glucose from the blood, putting it into the cell, and now the cell is creating ATP from that. And so we're not getting that signal, and the brain thinks we're starving. And so that kind of ties it all together. But the thyroid is a big player in ATP.
Wow. That was great. Thank you for explaining that. I mean, I bet that was connecting the dots for a lot of people out there. So that was, yeah, I mean, it sounds like if that's the case, like you have a thyroid that's lagging behind, your body's going to be working against you when it comes to losing weight. Is that right?
It's definitely right. The thyroid is, again, I think one of those things that maybe doesn't get enough attention in conventional medicine is the thyroid gland, and the testing in conventional medicine is a bit different than what we do in functional medicine and our view of normal versus optimal. So we pay a bit more attention to that because we see so many cases where we optimize someone's, Cole, I've seen so many cases where people come to us, they're on thyroid medication that their doctor prescribed them, like levothyroxine, Synthroid, which is, for the listeners, that's T4 only therapy. That is synthetic T4. And they come to us and we look at their blood work and their doctor says, hey, everything's normal. Everything's fine. You're good. We're going to keep your dosage the same. One of our practitioners, maybe it's me, maybe it's Sasha, maybe it's Gabe. We look at it and we say, well, this isn't good from our standards. And we give them a different medication, a different protocol. We optimize the T3 and they feel so much better. And there's a lot of cases like that.
Yeah. I hear about that all the time too. What so kind of rewinding back, just like thyroid, weight loss in general, what are the best ways to optimize your thyroid that you use with patients, both like using functional medicine as well as like functional medicine as far as like the more, because it's not, functional medicine is like, when the true definition of functional medicine is like all like lifestyle stuff, right? So the terms of like the more tools we have available at MedMatrix, as well as like the lifestyle stuff. So what are the lifestyle things you can be doing? And then what are all the tools that we use to ultimately help patients get optimize their thyroid so their body can really start working with them and, not against them, and things like weight loss.
Yeah. Okay. So Cole, you asked a great question about like, how can we holistically, functionally improve our thyroid gland, maybe naturally without medications, right?
Yes, that's what I said.
Okay, great. So the way that we can do that is we have to do the things opposite of what would damage the thyroid function first. And the first things that would cause that would be excessive stress. Excess cortisol really puts a damper on the thyroid, really affects the thyroid negatively. The next thing I would say is a lot of cases of Hashimoto's or autoimmune thyroid disease is as a result of gluten. And so I would say, to safeguard, if you at all suspect that there's a thyroid issue going on, you might as well just eliminate gluten and see if that has an effect. Gluten plays a big role negatively on the thyroid. And then the next one, believe it or not, you'll see this a lot in like super type A, orthorexic, kind of these guys that are like cold showers, ice baths, low carb, up at 4 a.m. These people are just like next level. They want to do like every biohack. But the problem is when you do things like excessive fasting and low carb dieting, your brain can't tell that you're doing that for health reasons. It literally thinks you're sending a starvation signal to the body.
Yeah.
And your body's like, dude, give me some carbs, find some honeycomb, find some berries or something. Because carbohydrates are really important in the liver, especially, and some of the deiodinase enzymes for the conversion of T4, the inactive thyroid hormone, into the active one, T3. So
yeah,
carbohydrates, really important. Not doing excessive fasting if you're lean, not being in extended periods of caloric deficit. Now, again, if you're overweight, obese, and you need that, that's great. But if you are getting close to your goal body weight, you want to kind of, take your foot off the gas a little bit. And then a big one as well is nutrient deficiencies. One of the big ones is protein, not getting enough protein for a number of reasons. One of the specific reasons is there's an amino acid called L-tyrosine. L-tyrosine is one of the building blocks of thyroid hormone. Not only thyroid hormone, but also dopamine and norepinephrine. So it's really great to get enough of these amino acids. And then you have nutrients like zinc, selenium, iodine, vitamin D, and iron that are also kind of these foods for the thyroid. The thyroid loves to eat them up and use them. And so if you have these nutrient deficiencies, you're not getting enough of them from your diet, your thyroid can take a hit. Finally, genetics play a role. Not that there's a whole lot you can do about that, but I would just mention it, that a lot of times we do see genetics playing a role. And I tend to see in my patients, way more thyroid issues in women than I do in men. It just happens to be the case. But that's really all the things that you want to sort of fix and or avoid to improve thyroid function.
Yeah. Man, so if you're taking a synthetic thyroid medication, would you say you 100% need functional medicine. You need to like go outside the conventional system to get things looked at.
Yeah, if you are taking synthetic T4, which is levothyroxine or Synthroid, and you are working with just a conventional doctor, whether that is an endocrinologist or even, a primary care doctor, but you just sense that something's off and you don't feel your best, I would highly advise that you at least look into a functional medicine provider who is going to take a little bit more time and a bit of a deeper look at it.
Okay, awesome. Sweet. Well, that actually kind of wraps us up here. We're out of time. So who should reach out to MedMatrix? What are the things that if you're dealing with these problems, you should reach out to us and become a patient?
You should reach out to MedMatrix if you are tired of not feeling not feeling the way that you feel that you should.
Okay.
If you want to be the best version of yourself, the most productive version of yourself, more energy when you wake up in the morning, you want to have less aches and pains and be there to run around with your grandkids rather than sitting down and hurting and not having energy, and sleeping deeper and clearing up your skin. All of the areas of your health are covered because at MedMatrix, we take a holistic view. We're not separating you into systems. You don't have to see a gastroenterologist and an ENT doctor and a neurologist. These are not separate systems. The body works together. And so we look at it all holistically. All of these systems connect. So if you think that you have or you're experiencing any of these things and you're just not feeling your best and you feel like your doctor that you go to, your primary care physician's not giving you the attention, the time, the depth that you're looking for, then MedMatrix is definitely right for you.
That's awesome. Thanks for sharing. Hey, fun, quick question just for fun. Who should not reach out to MedMatrix?
Oh man. You should not reach out to MedMatrix if you like if you hate feeling good all the time. Definitely don't reach out to MedMatrix.
Yeah. Awesome. Yeah, that's a good one. If you love taking prescription drugs, we'll
Yeah.
probably be another one.
If
Yeah,
you like taking a bunch of pills every morning for your blood pressure and cholesterol, we're definitely not right for you.
that's awesome. Cool, man. Awesome, Colin. Thank you so much. Really appreciate it.
Had a lot of fun. Thanks, Cole.